The Federal Capital Territory Health Services and Environment Secretariat has launched a groundbreaking telehealth initiative to transform tuberculosis care in Nigeria. The program, developed with Stop TB Partnership Nigeria, the National Tuberculosis Control Program, and technology partner MobiHealth, was unveiled at Dutsen Mokoranta Primary Health Center. It was commissioned by the First Lady, Senator Oloremi Tinubu.
These diagnostic machines will be deployed across Nigeria to enhance rapid, accurate TB detection, especially in underserved areas. They will help break the dangerous chain of transmission by ensuring that those infected are quickly diagnosed and placed on treatment. It is important to say that to end TB in Nigeria requires not only machines and medication, it demands resources including human, financial, technical, and political.
New Hope Initiative. I think you all agree with me that it is promise met and it is promise kept. Excellency promised donated 1 billion naira in 2024 and again 1 billion naira in 2025. And she has delivered decisively on those promises to see that Nigeria ends TB by 2030, and as we have heard by today. We are very fortunate, the people of Buhari, the people of FCT and fellow Nigerians, to have a First Lady who cares about the people. Her heart is deeply connected to the sufferings of Nigerians, and she is doing all that she can from her office with her goodwill to see that we bring relief.
There is no village in Federal Capital that His Excellency have not touched their lives. I want to say, since I was born, I'm not exaggerating, but I'm saying nothing but the truth. Some people will feel so hot, but I want to say nothing but the truth. If you go down deep, you see that I have a root somewhere, but I want to say, I want to align myself with President Bola Ahmed Tinubu for what he has done for the people of Federal Capital Territory.
State-of-the-art diagnostic machines were commissioned capable of detecting TB in hours instead of weeks. A live telehealth demonstration showcased 24-hour access to doctors, genuine medicines, and diagnostic services, even in remote communities.
The test is very effective, it's simple, and it can access about 6 Yes, it's 95 points, and then we have about 16 samples that can go into the machine at once, so we can do a lot more with the machine than the previous ones we had.
Thank you very much, Your Excellency, for this donation, which has made testing and diagnosis something that will take us a few days, can happen in a few minutes, less than an hour, Your Excellency, in a primary health care center. That is our joy, that is our hope, and that is our belief that we can end TB. Thank you very much.
And for us to have this partnership to get e-health down at the community level is a fantastic one. It is something that I would say we appreciate it, and the more is going to come because we are going to expand. It's solely free. It doesn't cost anything for them. You know, people in the community or primary health care is solely taking care of people in the community who are vulnerable, whom we know that their pocket is less, and then that is why FHIS is there. That is FCT Health Insurance Scheme is free, and the women here that come for this celebration, we are going to register them free of charge in the FCT Health Insurance Scheme, and it will take care of their from the ANC down to the delivery and everything. And also if they have TB, it's also free.
Trained staff are here. The patient comes, the trained staff will help the patient to connect to the doctor, even in America, even in Canada, and the doctor will be able to see the patient from this place. The doctor will talk to the patient one-on-one, and whatever treatment that is supposed to be offered, the doctor will prescribe it right here and then. And there are some investigations that we can do within this facility. Those investigations that the doctor will write, we will just do it and send it to the doctor, and the doctor will read the results and give you treatment. Following up can be done like that. So you don't even need to be educated, you don't even need to be learned. There are even doctors that can speak different languages, because that's the way MobiHealth is recruiting the doctors. Doctors in different specialties, doctors that can speak different languages. So even if you cannot speak English, come here. If you are Yoruba, we will look for the Yoruba doctor that can convert between Yoruba, and you will talk well. So with this, I believe so much that this gap of no doctor, because if you go to hospital, if you know that there's no doctor in the hospital, will you go there? You won't go. And that's why people are going to Metama, going to FMC, even to the extent that malaria cases will go to national hospital. It's not supposed to be so. But now, if you know that if you come to do say Makaranta, you'll be able to talk to a doctor, you will come, I believe.
We know that telemedicine can solve more than 60% of medical problems, and the primary health centers are at the bedrock of any healthcare system. 80% of medical problems should be resolved at the primary healthcare level. But what we have in Nigeria is an abnormality where patients, out of lack of trust in the primary health centers, there are no doctors here to see me, so I'll just go to the secondary and tertiary centers. What that means is that 80% of problems that should be solved there are now referred, majority of them go to the secondary and tertiary centers, overburdening the health system. It's not cost effective, because the secondary and tertiary centers are meant for super specialists for complicated cases. Only about 30% of cases should be going there. So when we now have a mass utilization there, it puts a lot of burden on the health system, and that's the problem that FCT is trying to solve. So with the Federal Ministry of Health support and the support of the Honorable Minister for FCT, I think this initiative will go a long way in transforming healthcare at primary care level.
Nigeria currently ranks 6th in the world for TB burden, with 1 in 3 cases undiagnosed. Officials say this innovation will bridge critical gaps, speed up treatment, and help meet the nation's target of ending TB by 2030.